finally acted this year to design a new eyelid speculum, which tries to overcome the problems associated with current eyelid speculums. I would like to present a new eyelid speculum design for intraocular surgeries, which provides adequate exposure of the surgical field without causing intraocular pressure rise by pressure on the globe, and also avoids damaging the levator palpebrae superioris. We encounter a few problems during the use of existing eye speculums, including inadequate exposure, especially with the Baraka eye speculum, pain during eyelid retraction when operating under topical anesthesia, and an increase in intraocular pressure in the range of 5 to 10 millimeters of mercury in the case of eyes with a shallow orbit or large eyeball due to pressure on the globe by the speculum. Post-operative ptosis occurs in eyes with a small palpebral fissure due to levator palpebrae superioris damage by the eye speculum. Routinely used eye speculums at present include the Baraka eye speculum, which is lightweight but provides inadequate exposure many times. Liberman's eye speculum, which provides adequate eye exposure but presses on the temporal side of the globe in eyes with shallow orbits or large globes. And Cook's eye speculum, which does not exert pressure on the globe but provides inadequate exposure by retracting only the central part of the lid with its small blade length, while the medial and lateral parts hang sideways, narrowing the surgical field. In a eureka moment, I realized that current eyelid speculums separate both eyelids simultaneously, leading to the issues we face daily. If both the eyelids are retracted separately using two individual superior and inferior eyelid retractors, we can overcome these issues. During routine electric work in the house, I had observed that the copper wire used by electricians is very malleable and can be bent easily into the desired shape. So, I purchased an 18-gauge copper wire from the local electrical shop, and by following these steps, bent the wire into the desired shape and made my first eye speculum for retraction of the individual eyelid. This is the new improvised design, which I am currently using. This is a short video of the speculum in actual use during manual small incision cataract surgery. I am happy. Been able to achieve my goals of adequate field exposure, avoiding intraocular pressure rise, and preventing levator palpebrae superioris damage. Thank you.
Very good presentation and very well thought. These when you give the brittle sutures like that, in this time also, while you making the thread into the speculum, these threads also might get loosened, so you may lose the effect of the speculum and opening the eyes.
Yeah, that I have observed. I have to retie the brittle suture to the drape during the surgery 2 to 3 times to maintain the tension. Means to get the adequate exposure. If the brittle thread grip is loosened from the artery grip, then the speculum, the lead goes upwards or downwards towards the center. Yeah.
Atul, have you ever controlled like from the nasal bridge? If suppose you're using instead of from the temporal side, if you're using the same retractor from the nasal side with the self-retention, it works wonderfully and you don't have to worry about it because nasal field is out of your surgical area.
I have seen some videos of
because for my all LASIK patients, we always have a nasal speculum, nasal side.
Yeah, only problem is if there is a large eyeball or a short orbit, any speculum presses on the eyeball.
That you may have need to have
Yeah.
one or more than one speculum, but
Yeah.
then you decide which speculum suits a patient. Because
Yes.
you cannot have all the nasal bridge equal for every case.
Yeah, but-
Anyway, that's my 2 bits.
Yeah.
Thank you so much. It was wonderful. Please collect your certificate.